Welcome to Pedicab's BDS Express. In today's class, we'll be discussing a question. So before discussing this question, let me tell you that if you have not subscribed to our YouTube channel, please do subscribe and press the bell icon so that whenever we discuss any new question or we update any new video, you'll automatically get notified. Now, without wasting our time, let's start with the question. So this question has been asked in the year 2019 in AIPG exam, and the question was, given radiograph, point out towards the diagnosis of, and this was the radiograph. Now here in this image you can see that this is the pathology. So they are asking what it is, and the options given were, they were AOT, that is adenomatoid odontogenic tumor, COC, calcifying odontogenic cyst, then cementoblastoma and keratocyst. Now you can see that this is attached to the cementum or the roots of the teeth, right? And this is the radiolucent line, and you can see that this lesion, this is like a mixed density. So this thing, all these things, they are pointing out towards the diagnosis of the cementoblastoma. Now, why we are saying the cementoblastoma and the features of cementoblastoma, I'll tell you. Now, why we are ruling out AOT? So AOT, it is generally common in the upper anterior teeth. Basically, it is associated with the canines. So we are just ruling out this AOT because of the location. Then COC, keratosis, all these, they could be this thing. We can consider them as the differential, but they are not the exact diagnosis for such case. Now, cementoblastoma. So this cementoblastoma, it is said that this is the benign odontogenic neoplasm which is arrived from the ectomesenchyme. Now this term cementoblastoma, synonyms for the cementoblastoma, they are cementomas or true cementomas or sclerosing cementomas, apical, that is periapical fibro-osteoma, and periapical fibrous dysplasia. Now this cementoblastoma, it was first identified as a true benign tumor by Norberg in the year 1930s. Now, although cementoma, it is only mentioned as periapical cementoma, it is a type of osseous dysplasia in the 2005 WHO histological classification of the odontogenic tumor. So that thing only I told, that as per the histological classification, it is thought to be arrived from the ectomesenchyme. Now, cementoblastoma, there are certain classical features. First of all, usually the cases, they are asymptomatic. That is, patient does not complain of anything, and if you are just carrying out OPG or any other investigation for any other purpose, you tend to notice this cementoblastomas. Then second thing, if they are symptomatic also, then a patient might feel numbness in that area and pain, and slight enlargement of the cortical plates can also be associated with this. Now, the median age, it is said to be 20 years, and the age range, that is the median age, it is said to be 20 years, but it can be seen from 8 to 44 years of age with no sex predilection, or you can say with slight male predilection, right? Then now OPG features, or the radiographic features. In radiographic features, it is typically radiodense or mixed density. Usually it is mixed density with rounded or sunburst appearance and a relatively radiolucent rim. So this is the radiolucent rim which is attached to the tooth. Then loss of periodontal ligament space along with the root resorption or the loss of root outline, all these things, they are common. And first and foremost thing, you can see that this is attached to the roots. Here you can see the resorption of the root, right? Now, it is most commonly seen in the mandibular molars as compared to other location. So this is quite common in mandibular molar region. All these points, they favor the diagnosis as per the question, because in question they have given an image in which the cementoblastoma, it is attached to the molars, that is mandibular molars. Now, coming on to the differential diagnosis of cementoblastoma. So differential diagnosis, it is quite important. So if you are posted in oral medicine department, or if you are doing PG from oral medicine department, Differential diagnosis, it is something really important. So you need to know at least 2 to 3 differential diagnosis for every case. So cementoblastoma, the differential diagnosis, they are ossifying, or you can say cemento-ossifying fibromas, because they have very similar appearance as that of cementoblastoma. Then osteoblastoma, cementoblastoma or osteoblastoma. Osteo means bone. Okay, so very similar appearance, but it is not attached to the root. So this is the differentiating features. Then third is the osteosarcoma. So all these, they are considered as a differential diagnosis for cementoblastoma. So before we proceed further, let me tell you that if you have not subscribed to our YouTube channel, please do subscribe and press the bell icon. And we are also posting update on these WhatsApp group. So you can just press on this link, www.medicoapps.org/groups. So we are posting update as per your year. Regularly we are posting. So if you are first year student, we are just posting first year content. For second year student, we are just posting second year content, and so on. So, and let me tell you that this is limited. So I just suggest every student, you can just go and check out these things. Now coming on to the answer. So as we already discussed, cementoblastoma, location. Now points which we are considering to favor this diagnosis. First is the location. Then second is the radiological features, right? You can see mixed density attached to the tooth. Then radiolucent rim around the tooth. And you can see the resorption of the roots. So all these things, they favor towards the diagnosis of cementoblastoma. So this was all about the class. Hope you like the class. Just follow our channel so that we can, whenever we are just posting any new video, you'll automatically get updated. Thank you.